Up to 1 million people are facing starvation in West Africa because of the Ebola epidemic. The United Nations says border closures, quarantines and crop losses are exacerbating the crisis. A report by Plan International says families untouched by the disease are facing economic ruin, and children are at greater risk of abuse and being forced into begging, crime and child prostitution to survive.
Health workers are going from street to street looking for the sick. It's one of the newest tactics to stop the spread of Ebola in West Africa. This time, health workers have found a man who may have the disease. He's been lying here for 6 hours. Authorities act quickly, but it takes 3 hours for the ambulance to arrive.
What we're seeing at the moment is that the hospitals and the clinics are overstretched.
And Plan International's latest report into the Ebola crisis says the problems are much bigger than that. Plan International says in Liberia, the Ebola outbreak has caused the price of food to skyrocket. Rice prices have doubled, and the rate of inflation means 70% of households are struggling to feed themselves. The price of all kinds of medicine has also increased beyond what people can afford, and children are no longer being vaccinated. Maternity services in some areas have also ceased, and so has healthcare for non-Ebola patients. And there is a fear a generation of children will be lost to poverty or crime. Many children have become orphans because of Ebola. Dozens of schools have been shut since July, and unemployment has increased dramatically. Plan says it fears that mix is leaving a generation of children in vulnerable positions.
One of the traditional coping mechanisms that you often hear about in disasters is child prostitution. There is begging, stealing, that sort of thing on the streets as well. We're not saying that this is rife amongst the communities, but it is something that we're worried about as the deterioration of the situation continues.
The report paints a bleak picture for West Africa, but there is some hope.
The Ebola orphans are growing in numbers, but what we're also seeing is that communities are taking in these children and providing them the love and the care that they need to grow and to flourish.
And other agencies are seeing progress too.
The Ebola response strategy is working, and we are beginning to see improvements. But now is not the time to ease up on our efforts. As long as there is one case of Ebola, the risk remains. We must do everything we can to get to zero.
But at ground zero, that number remains a long way from reality. Iskandar Razak, ABC News.